Good morning, Madin Va. Thank you first, Maria Palambini. Meeting you at a conference in our home state of New Jersey made all the difference. I sat happily at your round table. Blockchain was the title. We knew immediately our passions aligned. We are on the course to find the way to make blockchain work for the scientists, biotech, pharma, engineers, and most especially, I remember you cupped your hand in a fist and you said, "Jean, you have the opportunity to reach the patients," and exclaimed, "That will make all the difference in the work we are doing." My presentation begins way before this slide, to 1938, the year my dad, Jack Burke, joined the Prudential Insurance Company, working with the first computers. He took time off to fight in France and Germany in World War II. As a senior method analyst in the 1950s and 60s, he turned the containers of file cabinets filled with insurance data into conduits using the available technology, mainframe computers. Growing up in his household with his DNA means I have always been in technology, more like my 12 grandchildren, the Generation Zers. Curious? 3 things I will show you. 1, a very vibrant cystic fibrosis community that has been in association with each other since 1996. I was an original .comer, purchasing over 100 medical domain names. Cysticfibrosis.com was one of them. You will be convinced that they have an unmet need, one that technology can fill. This is a challenge that someone like Kevin Kelly would agree is what technology wants. You will be inspired to wake up your imaginations and come on board thinking of ways you can help and be involved because you will love them. I have been known to use my favorite metaphor, The Wizard of Oz. I used it in 2011 in a blog post for Pharma Forum, and hence I won maybe the first Patient Centricity Award from Paul Turner. I am also a founding member of the Aurora Project, also out of the UK, so I am in the right place. The cyclone. The Wizard of Oz, and in fact the disease, begins with a cyclone, and the diagnosis of cystic fibrosis is definitely life-changing. One of our members, David, with CF, a geneticist himself, claims, "Things are happening in our lifetime that would be unethical to study in a healthy person, making our community and ones with similar chronic diseases a perfect study." We surveyed the CF community and they provided insight. A few key messages from our community will follow. I will be using the research from the 2 surveys. The first one, Discovery, Research, and Profit, was written with Corey Nislow, PhD of the Genetics Lab, University of British Columbia. The online survey ran from October 2017 till April 2018. The second one was run this past month, and it is aptly named Blockchain and Clinical Trials. We asked them, "Are you interested in an app for discovery, research, and profit?" 1,200 plus respondents agreed, indeed they are. Their ages is no longer, as you can see, a childhood disease. Over 50% are the ages 19 to 44. Good care and long treatment regimens, up to 6 hours a day, and the latest medications are working. One of our members says, "We are professional patients." Still curious? You will be convinced that they have an unmet need. There is so much information personified by the scarecrow in search of a brain. And finally, now we have the technology to turn mega amounts of data into information. This is a genetic disease, and identities become attached to the 2 or even more mutations on the CFTR gene, and perhaps even other genes. There are more than 2,000 mutations and counting on the CFTR gene. And so we asked them, do you know your mutations? And you can see, indeed they do. Different countries have access to different types of diagnosis. And one member from Pakistan tells us, unfortunately, in Pakistan, only double delta F 508 mutation test is available. I have that mutation, but there are so many patients who don't know their mutations. And another caregiver from Israel tells us, now Israel tests for 14 mutations. At a conference in Washington in April, I met with the head of rare diseases in Malaysia. She assured me there were lots of CF patients there. Wait, I thought for sure this disease was for the Irish. My 1920s ancestry information speaks of Aunt Kay, who had a terrible cough, and she died young. Did she have CF? We asked the patients and caregivers, what data are you collecting or willing to collect? Along with genetic data and spirometry results, medications came in first. It is not surprising because they can be on 40 different medications in a day. This and all the other data they are willing to collect is an opportunity for more data and information integration. I bet you're wondering, how do patients keep track of all the valuable data they are contending with? We asked them, how do you keep these records? Surprising answers, 30% keep no records, 50% paper or hard copy. I'm familiar, I've been to their homes and I've seen the filing cabinets and the refrigerator doors filled with clips and magnets. Some, 32%, keep digital type spreadsheets, but only 16% keep records using technology on mobile devices. The opportunity is clear. More consistent data using technology is more actionable. I am very excited today to be presenting with Robert Chu of Emblema because his app, based on blockchain technology, Patient Truth, can organize the data into information owned by the patient on their cell phones. This disease may be recognized through different symptoms on the lungs, gastro, sinuses, pancreas, or perhaps one of the different types of tests spot the two mutations needed for a diagnosis right away. One member still looking for his second mutation tells us Johns Hopkins database of over 2,000 mutations found his one mutation, D11528, and now he is in the Johns Hopkins special study to find mutations on 3 other genes believed to affect CF. So other genes now. At this point, their care is dependent on many different healthcare professionals. Lots of data collected there too. You can see now why we are officially in Oz, thanks to my 5-year-old grandson Elliot for the background screen. There is a new identity, even a new set of linguistics, as CFers, as they refer to themselves, now clearly are identified by their DNA mutations and their pulmonary function scores. And the CF centers are commissioned to take these 21 categories and give an assessment to the Cystic Fibrosis Foundation once a year for all their data. All this checking and entering done by hand and by available staff is, according to CF nurse Tamika Grubbs, an opportunity for mistakes to be made. It is unfortunate because these assessments are the data that is sold to pharma. Ah, the tin woodcutter, in search of a heart, ready to make the roadmap. He's my favorite. Persons with cystic fibrosis cannot be together due to the possibilities of cross-infections. So the community site, developed in 1996, has meaning beyond the usual tribal development. As a math and computer science teacher, I love new technology. The forums have been active for 23 years, along with social media, Facebook, Twitter, and Instagram. Since I have been reading the millions of searchable messages, I do declare myself a bit of an expert. I long to find the right technology for the community. I get excited with each new passing device which may make a difference in their lives. I hope you will agree that blockchain may just be the answer we are looking for. As the site founder and owner, I always hire health opinion leaders from the site if I have the funds, and this slide holds my business card. A bit of a sacramental for me. Designed by a very talented businesswoman with CF in South Africa. When we are lucky, Lene works with me, designing the site and newsletters, keeping me from going crazy. And this community has the courage. We asked them, did you, as a person with CF or the caregiver of a person with CF, wish to contribute even more? And of course they do. They are their best cheerleaders, urging each other on into clinical trials, even remembering back 20 or so years for the first clinical trials run by Genentech. Sometimes they even feel guilty that others did not qualify for a trial that they are lucky enough to be in. One member said, if only we can work around schedules, out of school, out of work hours, and no hospital stays. How far did you travel for a clinical trial, we asked them. They go the extra mile, from 5 miles to 72,000 kilometers by plane, and this may be a good reason to ask for no hospital stays and every amount in between they've traveled. We wondered, after all, if compensation would matter. This could change the marketplace for this community and others with valuable patient data. 68% said yes to sharing their data for compensation. 33% said yes without compensation. 29% liked the idea of part of their compensation going to charity of their choice. And only 5% said no, no compensation. We had lots of comments for this one, and of course throughout the survey. My favorite one for this is private industry is going to benefit financially and compensation levels the field. The potential wealth in genomic data is beyond comprehension. We are still curious, asking the community, do you wish the company holding the trial reported back to you, as a person with CF, about the collected data and their findings? And indeed they do. 81% agreed, one stating it would be nice, one reporting his doctor had informed him, and one stating the trial she was in was terminated. And the European law GDPR. I love to think of it harking back to Genesis, as that we are important, that we are made even in the image and likeness of God, with the breath of God in us. And now, in that same vein, blockchain is set to help with our self-sovereign identity. This is a thundercloud. Actually, our member Cohen Vingerhoutz, a dad with a young son with CF working in blockchain space, helps us understand that. He said in Europe it's known as a tidal wave. New technology evolutions like blockchain allow the creation of a platform on which you are the sole owner and viewer of your data. You administrate your data and you decide who has access to which parts. This brings me to author Frank Baum's Wizardry and the Emerald City. The approach is daunting, and I wonder if out of the curtain will appear just some real people, just like all of you, who are at work doing marvelous things. And one of our members claims this is an exciting concept to open communication between the actual creators, scientists, and patients without using the doctors as translators. I think this will open a new world of info and products to make our lives healthier and easier. Thanks. Wizards, are you a patient, a caregiver, a scientist, pharma, biotech, and my personal favorite, a teacher? Dr. Ken Robinson, PhD, the most popular TED Talk ever. Where is he? The native Liverpoolian, a polio survivor, the teacher looking for three things: curriculum, teachers, and creativity, where drama and dance play a big role. Lots of curriculum here as we peer into our bodies and learn what makes them work. Our genetics, be it our lungs, our sinuses, our gastro, our pancreas, medications, all the tests, PFTs, glucose monitoring, bronchoscopies, port and PICC lines, G-tubes, delivery system, and the beat goes on. And here you meet some very courageous people, ready to work with all of you. Survey participants came from 34 countries and every state in the USA except Wyoming. Even though the brilliant Jewish philosopher Emmanuel Levinas said the only thing that really converts people, the ultimate moral imperative, is the face of the other. In the USA, where healthcare is tenuous, isn't always possible to show your face if you have a pre-existing condition. We have formed a 20-member pilot work group with Robert Chu and his team at Patient Truth, some who decided to show their faces to all of you. Amber, a young woman of 27 years old, we gathered around her as she received her lung transplant at 14, then her kidney transplant from her mom, and now she can hear again with cochlear implants. She is an artist. At the moment, she's struggling to get her insurance on track. She's insured, but the medication needs to keep her alive and is not being refunded without a fight. And Daniel, a young man working in IT from Maryland. Daniel generously helps out with some of our IT concern, and they include also a caregiver from North Dakota and her son born with meconium ileus, a blockage of the small intestine. He was rushed to a neighboring state for care, and now he is a strapping high school freshman. His mom joined our forums immediately when he was born, and now she has over 20,000 postings. She is present. And a woman who just celebrated her 40th birthday from Massachusetts joined our pilot group. She has been in 2 clinical trials for the precision medicines that have come from Vertex Pharma. She also has a 10-year-old son with CF. Lauren and I have presented together at I for Pharma conferences. She graduated from the University of Texas and then worked with Dell Computers in marketing. I remember she spoke to the audience about Ubi, the out-of-box experience patients have when they receive their medications. At the time, one of the meds had a metal top, and patients were cutting their fingers opening the cans. As the conference went on, we found out we both lived in the same town, Highland Lakes, New Jersey. I took my 2 young daughters to dance class with a local neighborhood woman. The class was in her basement. One day, Betty, that was the teacher's name, told us a little girl was joining the class who had cystic fibrosis and would not live very long. I remembered that story, and when Lauren told her mom, she told me her mom took Betty's advice to just keep Lauren active, and she thought that had made a big difference over these past 35 years. Which brings me to another dancer on the site. He was a ballet dancer. He sent me this message last year on LinkedIn. Many years ago, you found out I wanted to be a video producer and sent me a small flip HD digital video camera, telling me you just wanted to see what I would do with it. Being young and insecure at the time, I think the gift overwhelmed me enough that I never fully expressed my gratitude. But night before last, I was thinking of all the pivotal points in my life for which I am grateful, and I wanted to tell you how that impacted my life. I built my career to the point where I now contract with large nonprofits and educational institutions, joyfully working a career that I love and brings me fulfillment. That all started using the camera you sent me all those years ago. I just wanted to remind you of that and let you know that even though it took many years of work to see the fruit, the investment and kindness you showed me with that small gift gave me a platform to build a career that is not only helping me to achieve my dreams, but allows me to create resources that are seen by and beneficial to thousands. Thank you so much for your kindness and willingness to invest in a young person all those many years ago. And so I have included in this presentation Blake's video for all of you.
In the cystic fibrosis community, personal health data information is key. The more information available, the better pharmaceutical companies can tailor drugs and medical equipment to save lives and improve quality of life. Industry leaders spent nearly $2 billion last year on cystic fibrosis research. This data requires expensive, inconvenient in-person trials without your control over where your data is going. Using a digital app, you collect, record and track your own medical, genomics and lifestyle data. And these industry leaders pay for your data. You choose what data is shared. The more you share, the more you're paid. And the more you help the cystic fibrosis community by the development of new drugs and treatments. There is so much left to learn about cystic fibrosis, and your data could be the key to a medical discovery that impacts thousands of lives. We provide the researchers with your valuable information. Their work is made more efficient and you get paid. Let's work together to help our community and build a future for ourselves and our loved ones. Learn more at www.cftechnology.org.
I know you agree this is a very vibrant cystic fibrosis community, and you can see that they have an unmet need. May you be like the woodcutter who says a heart is not judged by how much you love, but by how much you are loved by others. And I hope after this presentation that your support can take our breath away. Thank you.